Quindi la mia relazione, aspetta, come fa? Ok, la mia relazione, il trattamento.
We have an Endo-Perivenous laser treatment of reticular spider and spider veins of telangiectasias of lower limbs. We have seen till now the treatment of the big saphenous vein. We now see other veins and how we can perform this treatment. So no conflicts of interest. 15 years ago, we started by treating the great saphenous vein. At one point, we said, can we perform a treatment of small veins or more peripheral veins with the laser? We know that there are some cases. When we started, we knew that there were conditions for these veins that could not correspond to sclerotherapy. So we said, can we use another technique to get to this result, the result that our patients ask? So this is the story of how we started. So we started with transdermal lasers, 532, 808, 1064. All these wavelengths are used in the transdermal method. 532 as hemoglobin as reference point. So these small telangiectasias, these small veins, reticular spider veins, had to react because they had these chromophorus. But we didn't take into account the structure of lower limbs. The results were not positive when we were using this transdermal treatment. And then I'm going to show you some complications. So, if we are not very careful, we can have them. So, at one point, get the Endo-Perivenous treatment. So even us working not in the big city centers, received fibers, very thin fibers, thinner fibers compared to the fibers that we use when we can treat the big saphenous vein or the collateral veins. This is the evolution of the Endo-Perivenous method. In this case, there are several types of lasers: 808, 980, 1064, 1470. We used all of them to try and understand which was the best wavelength to have the best effect and to avoid the side effects at epidermal level. So you've seen the animation. The fiber is introduced naked without a cannula. It is introduced in the epidermic layer and it reaches the telangiectasia or the vein, the reticular vein, by penetrating in the veins or from the outside. So the indication of this Endo-Perivenous treatment: collateral veins, at the time of the surgery or at a later stage, recurrent varicose veins. We all know that this is a chronic disease. We cannot think of saying, okay, we do the sclerotherapy, we perform the laser, and in one surgery or in one season we solve the problem of our patients. It can improve But we can have also worsenings extrasaphenous veins, reticular vein, and spider veins, telangiectasias. With this technique, we can treat all the problems. Apart from the great saphenous vein or the small saphenous veins, we can treat all of the problems of the lower limb. In this case, with telangiectasias or reticular or collateral veins, what is fundamental is the initial study with the echo color Doppler of the lower limb. Otherwise, we will have a failure. We must keep into account what happened 15 or 20 years ago when we started treating with the transdermal method these issues. As you've seen before in the previous slide with the animation, so we introduced this optical fiber 100, 150, 200 microns up to 300 for collateral veins, and we connect it to a 808 laser. In this case, we obtain a photothermal coagulation due to the direct contact with the wall and also for the hemoglobin of the blood. We've seen before several heat waves that we used to try and understand which was the best wavelength on this point of the lower limb. And you've seen 532. Why 532 was used? Because as a reference point, as a chromophorus, and I'm trying to express a simple concept, but as a reference point, it has oxyhemoglobin 808 has oxyhemoglobin, hemoglobin, but increasing, we have other factors like water and fat. You see 9, 49, 80, 10, 64, and when we exceed this wavelength, hemoglobin and melanin are almost no longer there, are almost no longer seen, and what is seen is water and fat with certain problems. So why 808, this wavelength of 808 is optimal? Because it has a very low absorption with water and fat. So imagine a telangiectasia. When we have to use the cannulas, it's very hard, but when we are close to the telangiectasias, we have no absorption on water and fat. So these are the images of what happens when we are outside of the vein. If we are inside the vein, the target is oxyhemoglobin. When we are not in the vein, the target is, you see, is not water. Look at the difference between the two images after a treatment where we have an absorption on water and fat, and we can have scars or problems on the surface of the skin. So let's get into the details of what we do and what we should prepare when we have to prepare these reticular veins with the diameter more than 3 millimeters. Laser 808 with a 400 micron bare fiber, or 600 if we work on the collaterals, with a catheter considering the size of the fibers of 18G or 16G. This is our equipment. We have to use some local anesthesia. We should also use a cooling. We will see later the cooling, air cooling by direct contact. The more we cool the cutaneous side, the better results we will have from an aesthetic point of view. These are images that Dr. Zini also allowed me to use before, after, and at 30 days. And for the small reticular veins, diameter lower than 3 millimeters, what is important to underline? Well, the transillumination and polarized light that allow us to visualize these small veins in the dermal layer. The fiber is introduced naked without the cannulate, the needle, in the reticular vein, and insertion brings this energy directly in contact with the vein and with the blood. But what we should do before the treatment? Well, the skin cooling, as I said, with air cooling or ice, alternatively. And this is fundamental to avoid collateral or side effects. The fiber is 100 to 300 according to the size of the small veins, and the position is identified through these accessories, which are transillumination or beam light. Once we insert the fiber, we go back and forth with the movement until we see disappearing the telangiectasias. So the power is clearly different. We're going from 3 to 6 watts with an exposure time of 250, 750 milliseconds per millimeter. After the treatment, it's not very unlike a sclerotherapy with a compression. Well, we apply a moisturizing cream, compression, elastic stocking, considering the chronic disease, and immediate walking. So the materials, just as I said before, laser 808, 200 microns fibers, we can introduce with cannulas, but also directly, as in this case, before and after. The accessories that I've seen to visualize these telangiectasias completely change the image. So when we have this helmet with polarized light, it changes completely, and this is the transillumination. So you see this reticular vein, which you cannot see on the surface, but you can see it with the transillumination. This reticular vein has precedence over telangiectasias. Also, polarized light gives you a completely different image. So up to now we have seen a transdermal method. I just want to hint at what happened before, because some of you could buy a 532 laser or 808 laser to treat telangiectasias of lower limbs, One thing is treating the face, one thing is red angiomas, and another thing is telangiectasias of lower limbs. They have a completely different set of problems. So the lasers that we use, 532, 808, 1064, that Americans still love, but if you use 1064, you know that there are a few issues. This is a slide to gives you an idea of what how are the vessels of our lower limbs, and it goes, the 532 goes to 1 millimeter deep, so we risk of not treating completely the telangiectasias. And you should also remember that 532 reads very well the melanin on the surface of the skin. So this is the capacity of penetration. So it's all parameters that we have to keep into account. This is 808. I just want to underline, you see in the upper part the fluency, 100 joule per square centimeter. It goes deep, 4 millimeters. It can go deep 4 millimeters, but the power that we emit is very high, and we risk hypochromies. So we have to pay attention, because it's hypochromies. So once we realize that when we see the patient after a few months, because we've been working for a year on the lower limbs of a patient, these patients will not have 10 white dots like this that disappear. The patient could also not realize that focusing. So when we analyze 10 or 10,000 of these dots, the patient will see these hypochromias on the lower limb. She will see them clearly, and these dots can disappear, but it will take years.
Questo è un altro risultato.
So this is another result. It's not my work, it's a side effect. Here you see a patient who came to me after being treated with laser 808. You can see the white image of the laser beam, but also all the telangiectasias. So that means that they haven't been treated. We created a side effect, but on top of that, the photothermolysis was not there. So, and if you note, those telangiectasias are even more evident when considering a normal one. So this is the laser effect. Hence, when we treat with transdermal laser, we have to check the pulse time, its fluence, spot diameter, and its frequency. Of course, like all laser treatments, low phototypes or clear phototypes are the best candidates from this viewpoint. I'll skip these ones. What are the advantages of endo-perivenous treatment 808? With one session, if you agree upon this with the patient, you can treat the patient for the entire leg or the entire limb. There are no allergies involved, no problems in terms of quantities to be introduced into the lower limb, like with sclerotherapy. Time is actually our only constraint. I'll have to talk about this with the patient. So we'll have a number of sessions throughout the day so that we get to a full result on the whole limb. The immediate effects that you can see straight away that we have to pay attention to are the following. So we have to study it and cooperate with some doctors who already treat such a problem. And I said a little bit of crusting forming in the days afterwards and little points of skin irritations that disappear in 4 to 8 weeks. We found a way to reduce this time frame for those irritation little dots so that the patient is not worried about those. Pigmentations and depigmentations are really rare, even if we use nude fiber with the right type of energy through the epidermis. So rare pigmentations, hyper and depigmentation, that's what I said. Concluding, with this Endo-Perivenous technique, I can get to different depths, even 4 millimeters down, and I do not have to count photothermolysis because the fiber is placed on top of the reticular vein or the telangiectasia directly 1 to 4 millimeters. And look at the power, the energy used, 3 watts with 50 millisecond impulses, considering the energy that we had on the tip of the fiber, with 1 to 2 joule per centimeter in terms of fluence. So in conclusion, this Endo-Perivenous treatment can be appreciated both by doctor and patients. No infections, no matting events, no scarring in the lower limbs. We will now see the pictures. How about the costs? Of course, you won't buy a laser just to treat one pathology. I will have to buy it depending on my surgical skills in operational terms with a number of problems. Laser 808 applies to dermatological pathologies, so you will definitely see the economic advantages. I started off 15 years ago in this field, so I have to treat 5 to 6 patients a year maybe, whereas now I use that technique. I determine the completion of my treatment with sclerotherapy and with laser. Here is my literature reference. Endo-Perivenous laser on the ankle for small telangiectasias right away after the treatment. 1 month after the treatment, you can still see some reddish areas. After a year, so the patient came back for a full follow-up. You see 2 years afterwards and after 6 years. If a patient does not achieve the wanted result, she or he will go to another colleague. Whereas if she sees, or he or she sees those results, they will come back. This patient came 6 years afterwards. The inner part of the knee, small telangiectasias, you see at the end of the treatment, there's a little bit of skin irritation that goes away after a bit of time, after 2 weeks and after a year. The evolution, we will have a specific presentation on this, so I just touch upon this briefly. Here you see 2 different wavelengths. And you can also ask the company to include the wavelengths that you deem to be the best in terms of your operational characteristics from a vascular viewpoint, laser 532 and 240. But my colleague will talk about this, and I thank you very much for your attention.